Bill Gates is calling for pandemic firefighters in a new op-ed. Gates describes a network that the World Health Organization and its partners are creating called the Global Health Emergency Corps. This group includes the world's top health officials and emergency leaders who will prepare for the next pandemic, just like a team of firefighters would for the next big blaze.
But recent research from Pew reveals that the pandemic has eroded public trust in health officials and in politicians. So look, I read this op-ed. I'm, decently skeptical of the intentions of Bill Gates. We've scrutinized, his support for various potential mitigation efforts or therapeutics that he himself may have invested in, and how that has potentially changed how he's characterized these things over the years. But I read this op-ed. I think this op-ed is mostly harmless. It's kind of generic in just calling for better government preparedness for a future pandemic. Look, I think that's a fine thing to think the government should spend money on is preventing a pandemic in the future. Dr. Redfield, who we interviewed yesterday, was it was scary what he was describing, his fear that there is going to be a great pandemic, even bigger than COVID, in the future. So yeah, and it is important for governments to cooperate in that. And one would hope the World Health Organization was already doing some of that, but Bill Gates seems to think there needs to be an additional agency. Fine. I think the complicating thing is, well, one, if we need the whole world to cooperate, what do we make of the fact that in this pandemic we could scarcely get the Chinese government to cooperate with us on information sharing. The access to swabs and to genetic materials that they found at that market, right? We're just getting some of that now. That's why the raccoon dog story is in the news. They're finding that out now. They've been very reluctant to share information because they want to deny all responsibility, and that's a huge problem. So it's all well and good to say, we should spend more, government should do more, et cetera. Okay, fine, but there's practical limitations there.
Yes, and I think that it's likely, given the realities of liability, that any country where COVID started is going to have those same kind of information sharing issues. There's going to be conflicts of interest. The U.S. has its own conflicts of interest given its funding of the labs in China. And so that is a fundamental problem. I do want to say, specifically what he's calling for is things like increased testing. And Dr. Redfield said yesterday during our interview that was one of the biggest mistakes he personally made, was not understanding exactly how transmission happened and realizing that because of asymptomatic the prevalence of asymptomatic COVID, that testing should have been more emphasized.
Right, they were just testing people who were ill who had been to the area where the outbreak was.
Right, so they needed widespread testing of people even who weren't showing symptoms. So that seems very reasonable. In addition to environmental surveillance, meaning testing of sewage systems and things like that, again, to get a better sense of the prevalence of the virus or whatever the contaminant is in the general population. So I agree with you. Those seem like very commonsensical types of interventions. But the question is, given the gap in public trust that exists, are we now on the back foot in with respect to our ability to implement programs like that?
I would say some of this lack of public trust is justified. The CDC, the NIH, all these people, they have large budgets. They are able to do a lot, and they really were not prepared. They can say, okay, we need to be prepared. Well, what was your job then? Isn't your job to be prepared for something like this? They got testing so wrong. And look, I'm all for testing. I find testing to be one of the less intrusive manners of controlling the pandemic, so I actually tended to support it more than some other things that ended up being mandatory. But look, at least in the case of COVID, it turned out that unless you're going to follow up robust testing with some actual kind of quarantine measures, it was not going to make a dent. It was not going to keep the pandemic at bay. It was going to do some good, but you needed some actual commitment to then. People have to be. And the only countries really that were able to totally manage infections and keep them out were ones that were island nations that implemented very robust. Okay, no one can come here. This is locked down.
Sure, or you can come here, but when you get off the plane, you have to go right to the hotel. And you have to stay there for 2 weeks or 10 days or whatever the new protocols were. And look, there's a lot of critique of more strict shut down, genuine lockdown measures that happened in China and in Korea and other places. But there's something to be learned, I think, as well, where I think a lot of people would be happy to comply with a more strict quarantine requirement if it meant that the whole country didn't end up getting shut down the way it did. Mm-hmm. And especially if they were supported, so that they got paid time off, so they had groceries delivered to their door the way that so many people in other parts of the world got. They were actually supported in the quarantine and not left every man for themselves. So I do think that a testing program combined with those kind of social supports are a less authoritarian and less economically and socially disruptive way to go about doing this. The question again is it possible in a country as polarized as ours is, with a trust gap as big as it is, with Bill Gates as a human being, as a lightning rod for skepticism as he is, to get to a place where we can have bipartisan commitments to setting up the kind of institutional infrastructure that can really meet a crisis like this going down the line. And
part of the skepticism is because these government health experts, the people supposed to keep pandemics at bay, one of their strategies for doing so was to go into caves where there are infected bats and take them back for study. We don't know for any degree of certainty that was the origins of COVID. That could well be the origins of a future pandemic, even if it's not the origin of COVID. And there's some, I think there's some, and now we don't really trust the scientific community necessarily to be transparent in investigating their own role in that kind of thing. So this is going to be something different, but the mitigation efforts shouldn't involve making the pandemic more likely in the first place. Sure, I think that's very reasonable. I also think it's worth noting that there are some ideological barriers potentially conservatives getting on board with some of the mitigation efforts that I think are really necessary. So one of the things that really exacerbated COVID was not having access to things like respirators, masks, PPE for health professionals, because we don't make them in the country. And this is one of these central tensions. If we're following purely the profit motive, that means having products manufactured overseas to save money on the dollar. It means not storing things in U.S. facilities because those storage costs add up. And that's what was at the root of a lot of these supply chain issues that ended up negatively affecting the kind of medical and public health response to the disease as well. We saw this with the baby formula crisis. We've seen this with the monkeypox crisis, that there was an administrative choice not to keep the monkeypox vaccines on hand because it was costly to renew them when they expired and costly to store them. And consequently, when an outbreak happens, short-term profit versus long-term gain is a calculation that again and again and again benefits corporations, but at the detriment of the public. Right. So are we going to be able to get on board with the idea that the government should either pay for or manufacture itself the kinds of equipment that are necessary to respond to a crisis like this? I mean, you began that statement by saying you don't think conservatives would be willing to do that. I actually think many Republicans it appeals to them, the idea of building more of these things domestically in the U.S. I'm actually that's not where I am necessarily. I mean, we need access to these things. Can we make it easier to import some of them? There are all sorts of barriers to just more cheaply being able to acquire the things we need. And to be clear, I don't think that conservatives, regular people, are against it. I think that the conflict of interest, the ideological issue, is corporatist, regardless of their kind of political ideology. Those are the kind of top-down, profit-driven decisions that have led to political consensus for things like NAFTA, political consensus for sending jobs and resources overseas. This is not a left versus right issue, but it is a top-down issue. And there's some question as to whether or not our political system, being what it is and being as captured as it is, will actually learn from a crisis like the one we just went through and say, we actually do have to build some of this stuff at home. And people like Bill Gates leading the charge on these kinds of things, writing op-eds that talk about things that are legitimate. Are we going to do sewer testing? That's great. But I want the interventions to be more build things at home, store things at home, keep things on hand, American jobs, and a little less, let's expand the surveillance state so that Bill Gates can test our poop. Yeah, is that going to make them, but they're not going to necessarily be less expensive if we do them here. They're going to be more expensive. No, but I'm sorry. Wildly more expensive. That is I don't know about wildly more expensive, but when people were dying and bodies were stacking up in hospitals, people would have paid anything to have respiratory machines and ventilators on hand. So that's the question. Are you going to
Listen to the corporatists that tell you, well, you're going to have to pay a 20% markup on this thing, so it's better to ship it overseas. When we're talking about crucial life-saving care that can thwart or slow the progress of a pandemic or keep people alive in the context of a pandemic, should we be, as a society, making different kinds of decisions than we make on whether or not we can get value on the dollar of a car or something else that's less life-sustaining?
Let's partner with let's have some factories in, we had a health guest on a couple of weeks ago who was like, it doesn't have to be China necessarily because we can't rely on them, but there could be factories in Northern Africa, in the Middle East, in places like that. It doesn't have to be in the U.S. as long as we, have the system in place.
So that the politics of various other regions in the world can make or break our ability to respond to a pandemic?
Things can't be cheaply made in the U.S. I mean, if you want to change the laws and make that the case, that would be great, but you won't like those policies.
And this is the ideological barrier that I'm talking about. Are people going to be penny pinching?
It's not, it's reality.
So much that we have an unprecedentedly large war budget right now. We're spending billions of dollars in Ukraine, and the question is whether or not we can cost some percentage, pay a percentage more so that we can make our own protective gear in the United States of America so we don't have to be worried about a shipment from Morocco the next time there's a pandemic. I think that there's a false scarcity being described here that is frequently the false scarcity that is raised whenever we talk about what it would cost to build things at home, and not to mention the social benefit of having American jobs. Every time, Republicans, conservatives, you cannot make this argument that we need to get rid of NAFTA and have American jobs here and support American industry.
I'm not making that argument.
But wait a minute, Tucker Carlson just went kind of viral in a clip because he's the one that sounded like Bernie Sanders when talking to Ben Shapiro. Ben Shapiro says, if we have new technology that eliminates trucker jobs, would you support it? Tucker Carlson says, absolutely not. That's ridiculous. And he's dead
wrong. He's completely wrong.
He says it's absolutely ridiculous because of the social cost.
He made an economically illiterate argument. We could all build wagons and horse and buggies could carry us all around the place and we'd save some jobs. We all know that's ridiculous.
In a world where you want to put the most common job for American male workers out of business, you have to be prepared to offer a social substitute in the form of alternative career paths.
The social substitute is food costs less.
Wait a minute. A job guarantee, a universal basic income. You cannot throw such a significant part of the workforce out onto the street and expect there not to be rising crime.
It happens decade after decade throughout history.
Other kind of costs that negatively hurt society as a whole. When there have been transitions historically, when men come home from war, when there are radical shifts in the economy, there are growth programs designed to accommodate those new labor sectors. And that's the job of government, to protect its populations when those kind of shifts happen. Not to throw your hands up in the air and say, well, the market does what the market does.
The job of government is not to thwart progress, make everything more expensive for all of us by keeping us in the Stone Ages.
Well, if that's your political position, that the most common source of employment for American men under a certain age should cease to exist and the government shouldn't respond in any way.
If you want protection for your job, join the mafia, I guess.
Right, Robby.
More Rising after this.